Hi everyone, Dr. Rich Castellano, the Smile Doctor here at FaceLift. We're doing filler rhinoplasty today. Thank you, Christopher, for letting us share. Here we go, he's the man. And can we share what you do, Christopher?
Yes, go ahead.
Tell us, where do you work?
Well, I work at the Hard Rock Hotel and Casino here in Tampa, Florida.
Amazing place, by the way.
I consider myself a professional poker dealer.
So this is the man. If you have poker questions, he's the man. And there's a big tournament coming up.
Big tournament, starts today, $400 buy-in, $1 million prize pool.
Look at that. We just did a commercial for Hard Rock, but if I played poker, I would consider it, but I would just lose my money if I went into that. So I gamble on other things. I gamble on my life. So we're doing the filler rhinoplasty. We're going to just straighten up through the tip here and build up on the nose. I'm going to do a little bit of the cleanse. We got his photos there as well. And so there's no downtime from the filler rhinoplasty. Now, just as a demonstration, can you do me a favor? Put your sunglasses on for me, because I just want to see how they sit on your nose. So when his sunglasses sit on his nose, they're sitting on the iPad. So his dorsum, where we're going to be doing the work, is totally clear. So these, and they're very nice sunglasses, these are perfect. But if you wear any other glasses that push on the ridge of the nose, just be careful for those, okay? You can go ahead and take those off. So I'm doing a little bit of the cleanse. Now what I do is I like to do numbing under the lip and numb around the nose, so that way it's a little less sensitive. But once I do a little bit of that numbing, then you feel nothing. How do you do at the dentist office, Christopher?
I hate the dentist.
You're going to do better here. You're going to do better than the dentist.
But my dentist is a really nice guy, so.
Is he a really nice guy? So you deal with him, right? So I'm going to do a little bit of the numbing.
I have no choice.
All right, you're going to do great. So for my physicians and students that are watching, I like to do the sublabial block, and then I'm going to lift up your lip here. And I'll tell you what.
Take my gum out.
Here you go. You can just put it right there. We'll get rid of that for you. All right, so now I'm going to lift up the lip. Go ahead and close your mouth. And then you'll feel the buzz, and then a little pinch on 3 here. 1, 2, 3, pinch. You feel small, medium, big pinch, or not too bad? Little pinch, okay, all right. So we're not in a hurry, we take our time. How about here, small, medium, big pinch? Okay. If you need a break, you let me know, I'm not in a hurry. So for my physicians and students that are watching, filler rhinoplasty is an advanced technique. You should have an awareness of nasal surgery so that you can avoid complications and problems and challenges. This is not for beginners. Numbing in this area can bring up the, thanks. We got a little call coming in. We're busy doing a video. Do you feel pinching there? Not too bad? Okay, just a little pinch. So it's going to start to feel pretty numb. When you numb in the nose, the breathing feels a little different because you can feel the air going through your nostrils. How about here, a little pinch? But when you numb, you don't feel the air in your nostrils. So some people feel that their breathing is blocked when they're breathing just perfectly. Okay, how about here, a little pinch? A little pinch there. A little bit there. Sorry, a little pinch. And then, how about here, pinching? A little bit, okay. So little pinches are good. Let's let that part settle in. And then what I'm going to do, how about here, pinch? Small, medium, big, little bit. Okay, little pinches we can deal with, we can handle. Little pinch there, not too bad? Okay, so now what I'm going to do, I'm going to let that part settle. I'm going to hold a little pressure just to disperse that numbing. Now when I work from the top, I'm going to turn your head this way just a little bit. And I'm going to build in from right around here. So you're going to feel buzz and then pinch on 3. 1, 2, 3, pinch. Small, medium, big pinch there, not too bad. Just a little bit, okay. Are you feeling any pain right now?
No.
So it may feel a little goofy in the front of the nose just because of that numbness. So I'm holding. Is that tender when I push or not really?
Just a little bit. I mean, it's okay.
Do you feel that getting a little bit numb there? This is the anterior nasal spine, which contributes to some of our nasal projection. So now here, do you feel small, medium, big pinch here? Small, medium, big, not too bad? And so the numbing's helping because that's a sensitive area. How about here, small, medium, big pinch? Not too bad? Good. And so since I'm building up that nasal tip, I'm going to do just a little bit under here. Pinch, 1, 2, 3, pinch. Not too bad there?
Not bad.
There you go. So to achieve that, that is a very sensitive place. But now that he's numb, thank goodness for lidocaine. It's working very well. All right. How's Christopher doing? Very good. So what I'm going to do is we come at it from both sides. Now, do you feel a little bit of a pinch there? A little bit? Okay.
Mm-hmm.
So that's where the cannula is a soft tip cannula. So we make the insertion point. I'm going to turn your head back this way because that way the cannula has an entry point. And it's just like a little tiny pore. So we're using the Bella fill today. That is the permanent filler, long-lasting filler. A lot of my patients do one session for the filler rhinoplasty. Some will do second or third session. Let me turn your head this way. But that way you know, this is the best strategy to avoid a surgical rhinoplasty. If you need surgical rhinoplasty, great, but even if you do surgery on the nose, you might feel a little pinch here. You may need second or third treatment. So that's why this is such an ideal treatment. Very low injection pressures. You're creating a potential space in the soft tissue envelope. And obviously you want to stay out of the blood vessels. So with this technique, midline, gentle advancement of the cannula, difficult to get into. Be careful when you're using needles here. You need to be really aware and conscious of what you're doing. But I already see a nice difference. I see it already starting to improve, and I'm getting a little more projection on that nose. Christopher's gonna love it. Okay. I was just watching the movie Buster Scruggs on Netflix. That's a poker movie. Old West has a poker theme in it, right? Old West. So already it's a nice improvement. Like, I love what I'm seeing so far. But we're not done yet. Why don't you open up your eyes? Now, I'm not done yet, but can you see how we've made some progress already? So, and I'm going to start blending it a little bit more, but before we push this up a little bit more, when I'm looking on your profile, a little straighter, but we're going to keep going. If you can't see it, don't worry. We're going to keep blending.
I can see it.
How's it look so far? Are we heading in the right direction?
Yeah.
Perfect.
Yeah.
Little baby steps. You can't get off track when you're taking little baby steps, and the patient sees the progress. So I'm going to turn your head this way just
I
a
have a
little bit.
movie audition coming up soon, so.
Oh, there you go. Well, you'll be great for a movie. That's exciting. So now I'm building up the nasal dorsum, pinching the skin, and this is in the subcutaneous, below the soft tissue envelope. Perfect. Very good, very good. And thank you to Jamie. She set everything up so perfectly for me, makes my life so easy. And Caitlin is our award-winning camera person, helping us get good videos. We can teach and educate. I always look from many different angles. You see the shadows, you see the reflection of light, and every bit that you inject, it changes that. So this is really artistry. I have years and years of nasal surgery experience and facial filler experience. Been in medicine over 20 years, done over 4,000 facelifts under local anesthesia, thousands of eyelid treatments.
And Dr. Rich is so nice.
Well, you're so kind. Thank you. Go ahead.
He makes you feel very comfortable.
Oh, well, thank you. It's my pleasure. It's an honor to take care of my patients. We love our results.
I've been to 20 other doctors, and Dr. Rich is the only one that I feel trusted and comfortable with.
Thank you very much. I appreciate that. I'm gonna have to pay you later for that. Thank you very much. That means a lot. I really appreciate you saying
You don't
that.
have to thank me. It's my honor, my pleasure.
There we go. There's a lot of love in this room. I'll tell you, that's why I love medicine. We are helping people. We get to do creative things. And Christopher, he's a multiplier. Like, he gives good energy to other people. So when we give good energy to him and he gets a good result that he loves, he carries that energy with him.
Oh, absolutely.
Perfect.
I need to get your business cards as well.
Oh, absolutely. We got you covered. Thank you all for watching. Thank you for sharing. We're on TikTok. I sound like that. We're on TikTok, Instagram, Facebook. Look us up. Little pinch there.
Mm-hmm.
Perfect. Yeah, it's coming along beautifully. I love it because the results are instant. And, you know, if you have to do surgery, general anesthesia, there's risks involved. To me, this is much, much safer when you have a good injector. Now, it may look easy. Let me turn your head this way just a little bit. But you got to really be careful.
And the price is very reasonable.
Let me turn your head this way and turn a little bit more for me. Perfect. Everything's looking good. So now I'm just doing a little bit of the lateral nasal wall, a little pinching there.
Mm-hmm.
Just blending. All I'm doing now is just blending. And I'm watching, I'm injecting maybe even 1/100th of a cc here and there. Just a tiny bit here, a tiny bit there. Perfect. Wow, it looks so good. We're going to take some pictures immediately afterwards, still working away. Let me turn your head this way just a little bit, and a little bit more here. That's good.
Miss Meyer asked about consultations, wanting to know if they're complimentary.
Yeah, there's no charge for our consultation. Give us a call. We do face-to-face, virtual consults. If you book out a ways away for the virtual, they may charge for that, but you can do an instant virtual consult with our team. Give us a call, we'll get you right on, or show up in the office where it's an advantage to show up face-to-face, but we can even do consult virtually if that's easier for you.
And I feel so blessed being with Dr. Rich here.
Well, thank you. You're so kind and thoughtful. It's my honor, and thank you so much for being here. Now, I've got a little bit left, but what I want to do, I want to show you. Hold this for me, please. So can you see how we've been able to straighten that out when we look from the front and the curvature that you can see through here? How's it looking so far, Christopher?
Looks great.
Yeah. Now, I've got a little bit left. I want to keep building the tip just a little bit more through here. Okay. I'm going to build that up, and I might put a touch more there. But if you're happy, I'm going to keep working on the tip there, and just little by little, okay?
Yeah.
Very good. There's no restrictions after the filler rhinoplasty as far as your activity, but you don't want to push on the nose a lot. You don't want to, that's perfect on your head position. And you don't want to wear heavy glasses that can push on what the filler has just done for you. Once you've made that potential space, now you're working there. You're staying away from the blood vessels that way. That's great. We're just shaping the nose. Now what's interesting is it actually makes the nose look a little narrower, makes the nose look smaller when you're building up that dorsum. Let me look from this side here.
And what's really great, and a great feeling, is that Dr. Rich takes his time and explains everything to you.
That's my
so
job.
important. That is so important.
Well, good. I'm glad you got your questions answered. That's my job. Let me turn my head this way just a little bit. I'm just going to build. Let me look on your frontal. So I'd like to go back to the pictures here. We take pictures from all different angles. Okay. And that helps a part of the perspective. The perspective obviously changes the more you inject. There you go. That's what I'm looking for. Make a big smile for me. Big smile. Your smile will feel goofy since I numbed him. There you go. Big, big smile. There you go. Now relax as best you can. Okay, that's good. Okay, so I'm just going to keep building here in the tip. Any pinching there? By now, the numbness sets in pretty good. Feeling any pain there or not really?
No.
Thank goodness for lidocaine. Yeah, you can see he's much straighter on his profile. And we just fuss about the little details here. Perfect. Very good, very
And your profile is so important because it builds your confidence up.
Yeah.
I'm feeling like a new man.
Yeah, the purpose, when you're doing nasal treatments, you want to make sure that you are not taking away from the eyes. So a good nasal treatment makes the eyes look a little more emphasized and not a distraction from. Feel a little pinch there, not too bad?
A little pinch.
Okay. And then back a little bit through here. I just want to keep building that. Let me turn your head this way a little bit more. Perfect. Very good. Yeah. Very strong.
Oh, wow.
Yeah. Now, if we look on the profile, what I want to do is I want to show you on his profile here where, let me look here.
Oh, yeah. Can you see the difference?
Yeah.
Mm-hmm.
Where this was our profile, let me show you from the other side here.
Mm-hmm.
There we go. So when we're looking, here's the profile from before. I'm going to have you, yeah, that's right. If you look straight ahead towards the corner for me, I'm going to turn your head just a little bit this way. So can you see that angle there?
Mm-hmm.
What a difference in the profile. Looks very natural. So Christopher will pass the grocery store test straight away. Looks amazing.
I think it does too. I mean, it's a wonderful. I mean, you did a great job. I mean, I'm honored. I think I owe you more money.
Well, it's my pleasure. I need to hug you. You did great.
Thank you, Rich.
All right.
You did wonderful.
We're going to take some of your pictures right now. No heavy glasses, but otherwise you can do your regular activities. Call if you need anything. And then we do a 2-month follow-up because I want to check in and see how we are. Sometimes people may add a little bit more, but I think we're right on track. When you're doing filler rhinoplasty, it should not be painful. If someone's feeling a lot of pain or change in vision, that's an emergency. That's why you need to go to an expert. But this is the way filler rhinoplasty should go. Should be painless. So congratulations. Thank you all for watching. We'll see you in the next video. Let's do things the right way. Let's get your face continuity plan together. Dr. Rich Castellano here. We'll see you later.